Hey everybody, time for our segment, Real Men Wear Gowns. It's our campaign to get guys to put that medical gown on, get scanned, be proactive with your health. And today we're talking about something that affects so many families, especially as our population continues to age, and that is memory care. Joining me today is geriatrician Dr. Kevin McNulty with Franciscan Health. Thank you so much for being here.
Thank you for having me.
So let's start with, what is normal memory loss versus something that should be a red flag?
That's a great question. So our brain does change as we get older. Things take longer to do than they used to, but memory loss is never normal. Now, we all can have lapses in memory. I have lapses in memory. I've driven past my neighborhood a couple times without realizing it.
Whew, that's good to hear.
Yes, but when it starts to affect our function, things that we usually do, managing the money or driving to familiar locations, these are red flags and we need to be assessing individuals right away.
Can you prevent dementia or Alzheimer's?
In fact, we can. We can prevent or delay upwards to 45 to 50% of all dementia.
Wow.
In fact, if we could just delay it by 5 years, we'd probably cut the worldwide prevalence of dementia in half.
So what's that look like?
It's a lot of things that you usually hear from doctors. Exercise, a healthy diet, using your brain. We now know that certain medications can likely be potentially protective. We know certain medications that are commonly available over the counter increase the risk for dementia. So reviewing medications for polypharmacy, side effects of medications, but also making sure that we're not missing anything else contributing to it, and doing everything we can to protect the brain.
Sometimes when we are dealing with an older loved one and we're trying to convince them to see a doctor, to see someone like you, they're a little hesitant. Do you have any advice to help those of us who are trying to convince or work with a loved one to see you?
Yeah, a lot of people are afraid to come see a geriatrician. They think that if they see me, I'm going to say they need to go to a nursing home. My goal is to try to help people maintain their independence and function for as long as possible and help them stay at home. The vast majority of people with Alzheimer's or any form of dementia do live in the community. And so the more we can identify it early, get the appropriate diagnosis, the appropriate treatments, better plan and build that support system around our loved ones, the more we can keep them at home and keep them as independent and functional for as long as possible.
That's great to hear. And just on a personal note, what drew you to this side of medicine?
I have been personally touched by dementia on both sides of my family. My paternal grandfather was early onset Alzheimer's. He was in his late 50s when he developed it. My maternal grandmother was more your typical case. She was in her late 70s when she developed it. We were able to keep her at home the entire course of the disease. For him, unfortunately, we were not able to do so. And so seeing that impact and trying to help families is so important.
Dr. Kevin McNulty, thank you so much for helping us out today and being a part of the conversation.
Thank you.
And you can join our extended conversation online. We've got it at WTHR.com/realmenweargowns.